Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care. And in this episode, I would like to explain shingles, because this can definitely affect the eye and be painful and cause a lot of trouble. So, as you may know, shingles is caused by the same virus that causes chickenpox. Medically, this virus is known as Varicella zoster virus, or also Herpes Zoster virus. And in anyone that has chickenpox, once the infection is cleared, this virus can stay in the body. Now, it stays in the sensory nerves and can remain there dormant for many years and then be reactivated later in life. Usually this happens from age 50 to 80 in people, and it is more common in people that are immunocompromised or may have an illness or disease. But when it comes back, it gets reactivated from the sensory nerves and then comes out in the distribution of one nerve. So this, you will see, can come on the skin, and when it comes on the face, it can go into the eye. So when we see this, we call it V1 because that's the name of the nerve that controls the sensation up on the forehead, down to the eyebrow, the eye, and then also comes down the side of the nose. So this is the area, if you see someone that has shingles around their eye, where we get concerned that it could be going into the eye. Now there's some signs that we can see. If it comes all the way down to the bottom of the nose, there's a greater chance that it could go into the eye. And when it first happens, the shingles inflammation, people may notice a little bit of redness and pain, but then this can get worse to form a rash and then blisters or pustules. As it clears, the pain may still continue, but at the same time, they can also get trouble on the eye. So this can cause many different problems with the eye. It can cause inflammation and what we call dendrites, or spots on the cornea, that are also very painful in the eye and can cause redness of the eye. Inside of the eye, it can cause inflammation, what we call iritis, or it can make the pressure go higher in the eye. These are probably the most common problems that it causes, but also it can cause problems deeper into the eye, in the retina, with inflammation there. The primary treatment for this is antiviral medication. So it's best if these are started, particularly within the first 72 hours. And we have some great treatments now for this, like Valtrex, which is a very effective antiviral, and it can help the infection to clear more quickly, and also we think help better with pain afterwards. Now also, people could take steroids by mouth. This one is a little bit more controversial, but I believe that it works and helps with the pain, and also to help clear things a little bit more quickly. Now, people, when they get problems in the eye with this, the antiviral is good to help work and kill the virus, but they also may need steroid drops to control inflammation there. Unfortunately, many times this inflammation can be recurrent, difficult to control, and people may need to be on steroids for extended periods of time, even sometimes years, when the herpes zoster virus affects the eye. So if you have any questions about this infection, which can be very difficult to treat and can cause many problems like pain and decreased vision, please post. We'll be happy to answer them, and we hope to see you again soon next time on A State of Sight.